The EndoPredict test, I think, is probably an improvement in certain cases of breast cancer where we're not sure what we need to give in terms of with chemotherapy or not. First of all, the multidisciplinary group would triage patients into those that by guidelines. But there's a significant group in the middle that you don't know. And certainly some of the node-positive patients, if they don't need chemotherapy, it might be a very interesting group to look at. Yes, I do think that it's very important for a test like this to be performed locally, because the turnaround times when tests are sent away to, especially sent abroad, are much increased. And patients are sitting there wanting to know whether they're going to get chemotherapy or not, or wanting to know what their risk is. And if you've got a test that can be turned around in a few days rather than a few weeks, it's much more important. As to unmet clinical needs, I think there's a need for a quicker test than the molecular tests that we have for this particular group of patients at the moment. I think that's the major clinical need, and if this test can perform as well as tests that are sent away, or even better, then I'm sure it will be taken up. Intermediate categories in testing are a problem for the clinician. Pathologists like intermediate categories. We have intermediate grade DCIS and we have grade 2 cancers, but often the clinicians don't like an intermediate category because they then become uncertain about what to do. And I think for the oncologists and for the surgeons, the sort of black and white response into yes and no is good for them. Although I do think that some of the low risk patients that have maybe a 9-10% chance of metastasis, some of those will want chemotherapy and some of them will get it, and probably correctly.